What painkillers do you have after surgery, and for how long do you have them? So immediately after surgery, it depends on the surgery, right? If it's something minor, it might just be simple painkillers or even the local anaesthetic, and then help yourself. But if it's something more major, I'll go to the opposite extreme. Big abdominoplasty, you could be on something called PCA, which is patient-controlled anaesthesia, that little syringe driver with a button that you can press yourself. So those are the two opposite extremes. Not that many people go onto a PCA these days, actually, and
that's the one you see in the films, isn't it? Where they
yeah, and it has a lockout built in, so you can't overdose yourself, which people are a bit worried about, actually. So you have to tell them, look, you can't overdose. Some of them really give it a good go. There's not a lot of PCAs used so much because people just, we're finding, not using them actually as much as they expect to. It's often just a comfort blanket, and as much for the anaesthetist as the patient, saying, oh, look, let's put them on a PCA. A lot of the technique, it's not that painful, he says, not having had one done, but patients tell me often tell me it's not as bad as they were expecting, often. So you'll be on an opiate early on, you'll be on a non-steroidal anti-inflammatory, something like ibuprofen or naproxen, and you'll be on paracetamol, often. And we then downgrade that quickly to get you off the opiate. That can bung you up, and you'll find patients who do go home on an opiate, and it will often be because a well-meaning ward doctor has discharged them with it thinking they need it, but they don't, and the patient dutifully takes it, and they'll then ring us in a couple of days' time saying, I'm in excruciating pain from my constipation. So stop taking the opiates, and the pain will go away. You know, ironically, you stop taking painkillers and your pain will get better.
Do you, I get asked a lot, obviously I'm not medical, so I have to.
Yeah. You don't have to do that while you do it.
Do you recommend people get in some stool softeners or something after, just in case?
Yeah, it's worth it. So all of this stuff, if you are going to be taking a lot of codeine, and remember that cocodamol has codeine in it, so if you're going to be finding yourself taking a lot of codeine, it will bung up your poo. You will be pooing bricks, and you do not want to be, or not. It's even worse because it's going to happen sometime, and it's only going to get harder, as it were. So more difficult is what I meant. So you would want stool softeners on board. Now most people don't find themselves in that situation, but you don't want to be making dashes to the pharmacy. You don't even want to be sending a partner or loved one or whatever out to do it for you, because they're probably already stepping up a bit more than usual to cover, you know, the slack that has been left behind by you not being able to do quite so much. So, you know, just being prepared in that